I just want to say thank you so much to our wonderful AAP members. We had an outstanding amount of people who joined this webinar tonight, and we are so excited because AAP California is working with our state agency partners through the Center for Family Health, which includes the Center for Disease Screening, WIC, and Maternal, Child, and Adolescent Health. And we are presenting tonight what we hope to be the first in a series of quarterly webinars to acquaint our physicians with our state agency partners. And with that, I want to introduce Dr. Kirsten Rosen, who was the physician who brought all this to fruition. She is our team leader for child nutrition, and she and I met a couple of years ago at our Vegas conference, and we decided that this is what we needed to do and move forward. And I'm so excited, Dr. Rosen, and for our state agency partners, I'm going to turn it over to you. Dr. Kristen Rosen.
Thank you so much, Carmi. I really appreciate it. And I echo just what you said, that we are really excited that we're here and that we finally managed to make this happen. So thank you to all of you. And thank you to all of you that are finishing up a busy day in your clinics and taking the time to join this webinar and learn more about Center for Family Health, helping pediatricians keep kids healthy. That's what we're all about. So as Carmi already said, we are collaborating with the California Department of Public Health, and we have been meeting regularly with them since last year. And we've been helping each other, trying to figure out what should this look like, what can we do in the future, what is on their plate today, where are they going with their efforts and resources going forward. What specific questions might pediatricians have that are practicing out in the front lines, and what are our patients needing from us pediatricians in their work? So this is hopefully going to be a very helpful session that will introduce the various programs within the California Family Health or Center for Family Health, and with a focus on just that. And as Carmi said, I'm a pediatrician. I've been practicing pediatrics up in the San Francisco Bay Area for more than 25 years. And I'm happy to host this program tonight. In the past, I have put on a lot of CME programs, both for pediatricians and family medicine doctors that practice pediatrics. And I've been involved in precepting residents. I've been involved in advocacy, obviously. And again, this is a really important area for me. So what we're going to do tonight is to focus on a couple of different objectives, and I'm going to read them to you. So we're going to describe the mission. What you're going to leave tonight with is to describe the mission and key initiatives of the Center for Family Health within the CDPH. You're going to be able to explain how the genetic disease screening program assists pediatricians in identifying high-risk patients, providing education, and ensuring appropriate follow-up care. Also, to identify programs within the maternal, child, and adolescent health division and determine how to connect patients and families to these services. You'll also be able to recognize the eligibility criteria for women, infants, and children, the WIC program, and summarize the nutrition services and educational support available for low-income families. We do have 4 speakers, and it's going to be Matthew Green, who is the Deputy Director for the Center for Family Health, and Dr. Claudia Mikhail, Dr. Jacqueline Pascoe, and Megan Schlager. A couple of housekeeping information here. It's around a 1-hour Zoom meeting, give or take. We will prefer that you use chat just briefly if there's anything specific that you need to know right here and then. Otherwise, our speakers have asked that we can wait and do the Q&A session to the very end, because we have a pretty robust planned content. We want to make sure that we get through all of that. And some of your questions are probably going to be answered throughout this content presentation. And we do want to say thank you to all of you that took the time to send in questions in preparation for today's meeting. It was helpful for us to add an additional content as well. And again, a reminder that at the end, you will need to fill out a CME survey and an additional survey that will be sent so that you can get your CME credit. So with that, I don't want to take any more time. Again, welcome to all of you, and let's get started. And I'm handing it over to Matthew Green.
Great. Well, thank you so much, Dr. Rosen. So excited to be here. And as y'all have mentioned, I'm the Deputy Director here at the Center for Family Health at the California Department of Public Health. Honored to serve in this role. And I'm not seeing the slides, so I just want to make sure, are they up? And if so, we can go into that third slide. Just quick tech check. Are folks seeing the slides? Because I'm not seeing them.
Matthew, I have the slides up, but I guess I'm wondering if anybody else can see them as well.
We can see them. We can.
Oh,
Yes, thank you.
interesting. Apologies. For some reason, I am not seeing that on my end. So I will fly a little blind here, and we can go to the slide on the organizational structure that has governor's office. So we wanted to start off with just a quick overview of where we're positioned within the organizational structure. We report to the Health and Human Services Agency here at the department, who ultimately reports to our governor's office. So we sit under the governor's administration, and we have collaborations across our state partners with a variety of other agencies, particularly within our Health and Human Services Agency. This includes our Department of Healthcare Services, which I know many of you are very familiar with. So that's just kind of where we're sitting in the overall organizational structure. Our center, as you will learn, is comprised of 3 divisions: the Genetic Disease Screening Program, the MCH division, as well as WIC. Next slide, please. And so you'll learn in this PowerPoint or in this presentation that essentially there are so many services that we offer, so many programs that we offer, and they all align in one way or the other with our center-wide priorities and mission. So you can see here that our center mission is to protect and promote the health of individuals, pregnant folks, and their children. And our priorities are to support pregnant folks, parents, infants, children, and youth with their physical, emotional, mental, and social health, collecting and reporting on robust data on the health and well-being of California families, screening pregnant folks and infants for life-threatening conditions with our GDSP, communicating and educating on topics related to health and pregnancy, infants, children, and adolescents, as well as, of course, the focus of advancing equity in maternal, infant, child, and adolescent health outcomes. Next slide, please. And these priorities are further solidified in the individual missions of the 3 divisions. So here you can see, and we're going to start with the Genetic Disease Screening Program in just a second. Mission there is to serve the people of California by reducing the emotional and financial burden of disability and death by genetic and congenital disorders. MCAH is to improve the health and well-being of women, infant, and children and adolescents throughout the state. And ultimately, the WIC program, or Women, Infant, Children, is aimed at helping families across the state by providing nutrition education, breastfeeding support, healthy foods, and referrals to healthcare and other community services. So without further ado, I will turn it over to Dr. Claudia McHale to go a little bit deeper into describing the Genetic Disease Screening Program. Thank you. And you might be on mute, Doctor.
Okay. Thanks for the introduction, Matt. I'm happy to be here tonight with everyone to speak to you about the Genetic Disease Screening Program. I hope you can see me because I can't see myself right now on the screen. But I'll start off by telling you what we do. We have 5 branches within the Genetic Disease Screening Program. The top 2 are probably the ones that pediatricians will interact with or are most relevant to your work that we'll be talking about tonight. The first is the prenatal screening program. The second is the newborn screening program. The third is the California Birth Defects Monitoring Program, the California Biobank, and our genetic licensure program. And so I'll tell you a little bit more about each of those sub-branches in the next slide. Starting with prenatal screening. Our prenatal screening uses the MSAFP test and or cell-free DNA test to screen for various genetic conditions or birth defects, including trisomy 21, 18, and 13, and neural tube defects. And as of April 2024, we also added sex chromosome aneuploidy screening, or also known as X and Y chromosome variation screening, to our cfDNA screening panel. We screen approximately 50% of births per year using our cfDNA test, and approximately 64% of births per year via the MSAFP program. The PNS, the prenatal screening program, has voluntary participation, so pregnant people have the option to participate or not, and we urge participation. For our newborn screening program, you might be a little bit more familiar with that branch of what we do. Our NBS program, our newborn screening program, tests for approximately 80 different genetic or congenital disorders, including metabolic disorders, some endocrine disorders, hemoglobinopathies, neuromuscular disorders, and cystic fibrosis. It's a very robust program that's been around for since 1966 with our PKU screening. 1980, our program expanded, and it's been growing ever since. We now screen approximately 400,000 newborns per year, and this program has mandatory participation with an exception only for religious reasons or beliefs that would prohibit participation. So we'll move on to the next slide. So beyond the care that we enable for prenatal diagnosis and newborn screening, we also have a back end that you aren't necessarily seeing all the time. It's a research and licensing, our research and licensing branches. The California Birth Defects Monitoring Program is a birth defect surveillance program that covers 10 California counties. It was established in 1982. Our California Biobank is also a wonderful resource. It stores residual prenatal and newborn screening specimens and data for program development and research on maternal and child diseases. And finally, our genetic licensure program issues professional licenses for California genetic counselors. So we are supporting California healthcare through research and maintaining professional quality measures as well. Next slide, please. So who are the people we're serving? What populations do we hope to reach? We serve pregnant people, babies, and families from diverse backgrounds across California. And GDSP really strives to make prenatal diagnosis, newborn screening, and early diagnosis and treatment of genetic or congenital disorders accessible to all state residents. So we really strive to be inclusive in all of our work. And in the next slide, we'll pinpoint more specifically how we help pediatricians in your daily work. Our main goal really is to identify high-risk patients. So we would like to enable early detection and management of serious diseases with the primary goal of reducing pediatric morbidity and mortality. And we also provide a robust support system to pediatricians. We provide education as well as advocacy. We offer guidance to pediatricians through our area service centers who work closely with you when a baby screens positive on newborn screening, giving you literature such as provider action sheets and family action sheets that you can use to help manage that screen positive result and help families manage, a lot of the stresses that come along with that. We also provide CME programs on genetic and congenital disorders and screening processes. We have one coming up actually on Monday at noon on our primary congenital hypothyroidism screening. I believe that information might be available in the chat for you to look at. So please take a look and hopefully you'll register to join us. And then beyond the clinical support that we provide to pediatricians and primary care providers, we're also working to promote policies that will improve child health overall. So we're working on the front lines as well as in the background to promote health for children. Finally, another very important component of our work is that we'd like to facilitate follow-up care. Our team helps refer patients to specialty care centers for the diagnosis and management of detected disorders. So if a baby screens positive, we're there for you to help you refer to specialty care centers. We want to make sure that every baby who needs care will receive care without any concerns about financial burdens or delays in care. We're there to make sure everything runs smoothly and equitably for everyone. And so I wanted to share some more resources for you that you can follow up and learn even more about us on this page. A great place to start is the NBS Information for Providers page. So that's a long link, but even if you Google us, you'll see Google NBS CDPH GDSP Providers page. This is a great place to go, and I believe you'll be getting a resource page as well with this information. Another really great resource is our NBS provider newsletter. So that newsletter will keep you up to date on all the breaking news in newborn screening in California. We're very active right now. We just added a couple new disorders over the past couple years. We're planning on adding Krabbe disease screening coming up in mid-2026. So you want to be prepared for that, and we're here to help prepare you for that. The next great resource is the NBS contact information. If you ever need information from us or help from us, please reach out to us. And finally, this is such breaking news, it didn't make it onto the slides. We have just gone live with our newborn screening results portal for pediatricians and primary care providers to receive the NBS results electronically through the CalGenetic portal. I believe that might also be in chat as well. If you register for a CalGenetic portal, you'll be able to access the newborn screening results for babies who have been assigned where you've shown to be their primary care provider through that portal quickly and safely and securely. So please make sure to access that if you haven't already. And with that, once your patients graduate from newborn screening, we will happily turn them over to the great hands of Dr. Jacqueline Pascoe in our MCAH program.
Thanks, Dr. McHale. So I'm excited to talk with you guys today about the MCAH division here at CDPH. Next slide. So what do we do at MCAH, which is the Maternal, Child, and Adolescent Health Division? So we fund local agencies. So we receive federal funding and then we administer it to all 61 local health jurisdictions across California. And we also have other funding sources that, depending on the program, we administer either at the state level or at the local level, all of which are supporting the maternal, child, and adolescent health spectrum across the state. We support programs, providers, communities, and individuals. So we focus on evidence-informed and evidence-based programming that supports what we call our population health domains, so maternal, children and youth with special healthcare needs, and adolescent populations in California. So for our child range, that generally goes from age 0 to 21, and sometimes older than 21, up to perhaps age 25 for our adolescent programming. And we do a very rigorous data work, so surveillance data across the state, looking at population level data, specifically at things like maternal mortality, maternal morbidity, infant mortality, child and adolescent health, and other key indicators of health. And we work very closely with a lot of our other data partners across the Department of Public Health to make sure that we are able to see the state of public health for this population in California and identify data trends so that we can make actionable efforts moving forward to improve the health of Californians. Next slide. So I mentioned our 5 population health domains. So one of our funding streams is through Title V, which is a block grant funding that comes from the federal government. Title V funds are demonstrated to be used for these 5 domains of populations across California. And we have programming that supports each of these 5. So women and maternal, perinatal and infant, that generally is that first year of life, child, that supports children age 1 through 21, adolescent, which is really looking at that upper age, so 10 to 12 years of age, up to 21 to 25 years of age. And then we have special programming for what we call our SHIN group, so our children and youth with special healthcare needs and their families and caregivers. And we also think about all of the other people that help support the individuals in these population health domains as well. So the parents, the caregivers, and the guardians, they are all part of our MCH family, and our programming and our work is meant to focus on supporting all of them. Next slide. So I wanted to share a little bit about the programs that MCH supports, and I'll do so kind of by our population health domains. And then we have several programs that really do touch several of the domains. So we put those in a box called cross-cutting domains. So in our women, maternal, perinatal, and infant supports, we have Black Infant Health and Perinatal Equity Initiative programs scattered across the state. We have fetal and infant mortality review work, specifically in 2 counties in California, and then a lot of data work across the state. We have a preconception health initiative, some work specifically targeting maternal morbidity and mortality. We have staff that coordinates the regional perinatal programs in California, and some SIDS and SUID prevention. We have a SIDS or SUID coordinator in all of the 61 local health jurisdictions across California, and statewide staff that supports that programming. For child and children and youth with special healthcare needs, we do have some special innovation grants that we use to support local health jurisdictions that are doing innovative work to support these children and their families. We have what's called the CalInspire Innovation Grants, and those fund usually about 4 or 5 local health jurisdictions who are doing innovative work to support children and youth with special healthcare needs and their families and caregivers. And then new for this year, we have what's called the CalReach Innovation Grant that is specifically to support children and youth with special healthcare needs and their families that are in smaller or rural local health jurisdictions that might be facing very specialized issues that we can help support with our programming. Next slide. For our adolescent health domain, we have 2 programs, our adolescent sexual health education program that really uplifts youth in being educated about their sexual and reproductive health decisions and their families. And then we have the Adolescent Family Life Program, which I'll talk a little bit about later, but it's for expectant or parenting youth and specifically targeted to help them with life planning, life skills, learning how to be an adolescent and a child themselves while still parenting a child, and help support them in that special time of their life. And then cross-cutting, meaning these programs touch multiple of our population health domains. We have a local MCH office in all 61 local health jurisdictions, so public health departments in all of the 58 counties and 3 city public health jurisdictions across California. Each one looks a little bit different, and each one might have a different type or number of MCH programs, but we do have a local MCH program in all of our 61 local health jurisdictions. One of our biggest programs is the California Home Visiting Program. It specifically targets kind of that perinatal period, pregnant parents, and then up to mostly 3 years of age, but sometimes up to 5 years of age. And that's in 58 of our 61 local health jurisdictions. We have a state level Flourish Mental Health Initiative, and its job really is to support the upstream mental health prevention efforts, so especially family resilience, increasing positive childhood experiences, family bonding, and really preventing mental health issues for children and their families before they even start. We do a lot of work partnering with our CDPH Office of Oral Health to really support oral health for the entire family. And same thing with nutrition, physical activity, and breastfeeding. So we do a lot to support our families in that area, especially connecting with other groups across the department who are active in that space. Next slide. So I wanted to showcase a few of our what we call direct service programs. So these are programs that are in a small handful of local health jurisdictions across the state that are really focusing on providing one-to-one support for our participants. So our Adolescent Family Life Program, I mentioned it serves pregnant and parenting youth up to 21 years of age and their partners. It's a strength-based case management program, and its goal is really to improve access to needed services, build social and emotional resiliency, empower autonomy, especially in the youth's decisions regarding what they'd like to do for career attainment or their educational goals. And it's based on this framework of positive youth development, really uplifting the strengths of the youth who are participating. One of our other direct service programs is our adolescent sexual health education program, which serves youth 10 to 19 years of age, a little older if they're expectant or parenting. And the goal of that program is to provide knowledge and skills to make informed, healthy decisions around their sexual and reproductive health and their relationships, decrease unwanted adolescent births or unintentional adolescent births, and sexually transmitted infections. And this is an evidence-informed and based program as well. Next slide. Our Black Infant Health and Perinatal Equity Initiative programs serve Black birthing people that are 16 years of age and older and up to the 12-month postpartum period. And the goal of these programs really are to support the parenting people, promoting healthy pregnancies and improving birth outcomes for this population. Our home visiting program I mentioned a little bit ago, it serves pregnant or newly parenting families, especially those that might be at an elevated risk for poor health or social outcomes. And the goal really is to optimize and uplift the parental health and the family well-being, which will then improve the infant-child health and development and strengthen the family unit. Next slide. So how can MCH help pediatricians? So it's really about working together, which is what's most exciting about starting this webinar series, is thinking about how we can all work together to keep kids healthy. So some of the priorities for MCH is really to uplift the medical home, especially using the American Academy of Pediatrics criteria for those 7 components of what a medical home should look like, and making sure families know that that's the goal and that providers know that that's the best way to provide quality care. We hear a lot from our participants about the struggles that they have with access to care. So really working on leveraging our connections with partners like you on how we can help from a public health space, bring our children and families to care providers to get the care that you want to give, that you are giving, and that these families really need. We also do a lot really focusing on youth engagement and youth-friendly care. So especially in that transition age, we want youth to be aware of the decisions that they can make that promote healthy choices moving forward, and that we're listening to what they need, what they don't need, what they want, and what they don't want, so that we can provide the type of supports that are really most beneficial and wanted by them. And then in general, just working with our partners across the department to uplift all of the upstream preventive public health measures that are so important for children and families. So access to healthy food, access to open green spaces, physical activity, making sure they're getting their preventive care visits and their developmental screening, have the knowledge for injury prevention, bike helmets, safe routes to school, all of the things that you guys do on an everyday basis, we're here to partner with on a public health level to make sure we can make those things happen. Next slide, please. So I think Dr. McHale mentioned it. You should be getting a resource list where you can actually have clickable links, but just wanted to highlight some of the references and resources that might be most helpful for you as pediatricians. So we do have a website for our MCH division, and each program has a specific website that talks more details about the eligibility. You can identify which local health jurisdictions or counties these programs are in, and find out more about the evidence basis of our programs and the amazing outcomes that we're seeing. There's a local MCH directory. So again, there's a local MCH office in all 61 local health jurisdictions. So if you click on that link, that will tell you, depending on which county you're in, or even a small handful of nearby counties, the MCH director in your area and how to contact them. Like I mentioned, all of our LHJs are quite different, and we love that variety from our local partners. So it's a really good opportunity for you to reach out to your local MCH office and find out a little bit more about them, the programs that they're offering, and make those connections. In terms of data work, we have publicly available data dashboards for all 5 of our population health domains. So on that link, you can click through, you can find the population health domain, for instance, child or children and youth with special healthcare needs, and dig through some really amazing data charts looking at the state of the health of the MCH population across California over the last several years. And then like GDSP, we do have the option for you to sign up for an e-newsletter that gives you updates about anything happening at the local or state MCH level if you want to be interested. I believe there's an option that you can click that you're a provider, and we do tailor the information, so it really should be most relevant to the information that you need. So again, the clickable links should be in the resource list that you guys get, but just wanted to highlight what they are and how they could benefit you if you're interested. And I will hand it over to Megan from our WIC department.
Great. Thanks so much, Dr. Pasco, and good evening, everyone. My name is Megan Schlager, and I am the WIC Assistant Director for Services here at CDPH in the Women, Infants, and Children Division, or what we like to call WIC. It is certainly an honor to take this time to talk with more of you all about WIC, as I'm sure many of you have patients who are benefiting for the program, or perhaps you have patients who are eligible for WIC, and this is an opportunity to learn more and hopefully refer them to the program after this evening. So we'll go ahead to the next slide. So for those that may not know, WIC is actually a national program. It's administered under the United States Department of Agriculture, but here in California, the California Department of Public Health has the authority to implement this program across the state. The WIC program started actually back in 1974, and it was in response to the growing concerns nationally over malnutrition and poor health outcomes among women and children who lacked consistent access to nutritious foods. What sets WIC apart from any other nutrition program are really its four major tenets, and that includes our nutrition education that we provide, providing healthy supplemental food benefits, offering breastfeeding support, and providing healthcare referrals. So we'll start first with the nutrition education pillar. WIC really provides individualized and group nutrition counseling to help participants really make informed food choices and establish those lifelong healthy eating habits. The nutrition education topics range anywhere from prenatal nutrition, infant feeding cues, preparing healthy meals and snacks for children, or food safety and storage, as well as any general parenting information that really raises awareness about nutrition and health. And nutrition counseling is offered to families during their appointments, but participants also benefit from receiving materials, and we do pride ourselves in trying to make sure that we offer materials in multiple languages, or by taking any in-person classes or virtual classes that are really tailored to a participant's nutrition goals. Another major component of WIC is providing those healthy foods and formulas. WIC is actually one of those first programs to be considered a food for medicine program, in which we provide individualized food prescriptions to each of our participant categories. These food prescriptions are what we call the WIC food packages, and they're made up of foods that fall under certain food categories that are mandated by USDA. And some of those food categories include things like fruits and vegetables, whole grains, milk, dairy products, breakfast cereal, infant foods, as well as some non-meat protein foods such as legumes, eggs, peanut butter, and canned fish. The WIC food packages are based on recommendations from the National Academies of Sciences, Engineering, and Medicine, and those WIC food packages also align with the dietary guidelines for Americans. We authorize foods that are nutritious, high in vitamin A, C, D, iron, protein, as well as folic acid to ensure that our families are really meeting that nutritional need. And in addition to the healthy foods that we offer, we also provide routine standard formulas that are part of an infant formula rebate contract, as well as we provide medical formulas or medical nutritionals to any infants or toddlers that may have a qualifying medical condition and they can't get that medical formula through Medi-Cal or through their private insurance. WIC does have a formulary that shows all of the standard formulas as well as the medical formulas and nutritionals that we offer, and we'll highlight that towards the end once we go over resources for pediatricians. A third tenet of the program that you see there in the middle is the breastfeeding support that we provide for our families who are interested in breastfeeding. WIC really encourages breastfeeding as the optimal infant feeding method by offering counseling programs and lactation support that's provided by credentialed or board certified consultants who can either provide that one-on-one breastfeeding help, or they can offer breastfeeding help through various class settings. In addition, WIC also provides breastfeeding education to some of WIC family members who are there to be the champions and provide support for their loved ones who are on their breastfeeding journey. And as a part of this breastfeeding support, WIC also provides breast pumps for any qualifying breastfeeding individuals. And then last but not least, the fourth component of the WIC program is offering healthcare referrals. These WIC referrals are really that gateway to public health for many of our WIC families. WIC staff are trained to connect families to essential services such as prenatal care, immunizations, mental health. We offer referrals for families in need of housing assistance or if they are in need of any additional food assistance. And there's also referrals that are made for counseling services, either for those who are faced with domestic violence or substance abuse. Providing these referrals to the healthcare and to other community services really help address those broader social determinants of health and really reduce those health disparities that we know many of our families do face. So in short, we're more than just a nutrition program. WIC is really a preventative health program and also serves as a public health intervention that helps families really navigate complex social systems and overcome barriers to one's health and well-being. We can go ahead to the next slide. To be eligible for WIC, applicants have to meet income guidelines. And what those income guidelines are is that a participant has to be at 185% of the federal poverty level, or they may automatically be considered income eligible for WIC if they receive Medi-Cal, CalWORKs, or CalFresh. As the name of the program alludes, we do serve many women, infants, and children. However, the participant categories that make up who we serve include any individuals who are either pregnant, postpartum, breastfeeding, or chest feeding, any infants, of course, who are under the age of 12 months, and then children up until their 5th birthday. Many don't realize that in addition to this participant category here that you see in the middle, parents, foster parents, caregivers, they can also apply for WIC if they have infants or children who they are caring for and they have that low to medium income, or they also receive Medi-Cal, CalWORKs, or CalFresh. In order to participate in WIC in the state of California, one has to show proof of residency within the state. However, I think it is worth noting that U.S. citizenship is not required to participate in the WIC program. Currently, we serve here in the state of California just about over 1 million participants each month. And one fascinating statistic that I think many pediatricians may not know is that approximately half of the infants born here in California actually use WIC during their first year. We'll go ahead and move to the next slide. So how can WIC help all of you? WIC supports pediatricians by helping all of you improve the health outcomes of your patients, especially those who may be faced with food insecurity, or if any of your patients have adverse health conditions. Our WIC offices throughout the state are made up of registered dietitians, degree nutritionists, lactation consultants, as well as trained paraprofessionals who can identify those health issues early and really reinforce those healthy habits during critical developmental windows. More specifically, WIC aims to really increase key nutrients in your patient's diet, and this is achieved through those WIC food packages that I mentioned earlier, with foods that do contain nutrient-rich vitamins, minerals. We also authorize foods that help close the dietary gaps common in young children and pregnant women. We also help pediatricians by improving birth outcomes. There are studies that have shown that WIC participation is linked to lower rates of preterm birth, low birth weight, and infant mortality, really supporting healthier starts for all of your patients. And WIC can help pediatricians increase breastfeeding rates and successes. As I mentioned, that's a core pillar of the program. And in addition to being able to offer lactation consultants for one-on-one appointments or through our peer counseling programs, we also ensure that we provide accurate and culturally relevant breastfeeding education materials, again, in multiple languages. And we do ensure that our breastfeeding guidance aligns with AAP recommendations. WIC also supports healthy growth and development for your patients. As I mentioned previously, the nutrition education is really one of those core pillars of the program. That nutrition education, coupled with regular growth monitoring that WIC staff conduct, big part of WIC is we like to do heights and weights during WIC appointments when participants come in person. And so those collection of height and weights really help to ensure that your patients are meeting their developmental milestones and maintaining those healthy growth trajectories. In addition to collecting height and weights, we also work to reduce iron deficiency anemia. And as many of our pediatricians know, that is a common pediatric nutritional concern. WIC actually requires that each applicant be screened for risk of iron deficiency anemia. This is something that we collect when a WIC applicant is enrolling for the first time, and we try to follow up with that every year thereafter. In some cases, the hemoglobin screening can also be done at a WIC office. And then last but not least, here on this slide, WIC helps pediatricians by reducing childhood obesity rates. The nutrition education and counseling that our WIC staff provide really helps to promote those healthy eating habits early in life with evidence-based interventions that have really been shown to reduce obesity risk by the age of 4. And so we will go to the next slide. I recognize that there's a lot of resources here on this slide, but we have so much good information that really is aimed for pediatricians and healthcare providers. Just a couple things that I will highlight as real key resources. Under our general WIC info here, I think one hyperlink, that third bullet down, is our healthcare provider webpage. In essence, that webpage off of our CDPH website contains a lot of the hyperlinks that you see here. This nice, beautiful slide is just convenient for everything in one area. But that is a good webpage to bookmark and contains everything that pediatricians really need to know about WIC or referring patients to WIC. Under the food and formula column here, right in the middle, I will point out that one of the top of the WIC approved foods is a link to the WIC shopping guide. This is what participants use, and it shows all the authorized foods on the program. Another link that is really good for, I think, pediatricians to have is our formulary. That's the WIC approved formulas link that many pediatricians commonly ask, what formulas are approved on WIC? And that's where you can find all of that information right there in a handy resource. We also have training resources and forms that are convenient if you are going to be referring a patient to WIC for a medical formula. And then over on right-hand side, we have all of our links and resources for our breastfeeding support, which is very handy for pediatricians as well. And I think we can go to the next slide. And this is where we are really hoping to make this a habit, to continue this, where we could provide more bite-sized topics based on each division that we highlighted here tonight. I know for WIC, we're very excited. We could probably have a whole webinar dedicated to formula alone, but we would also love the opportunity come sometime perhaps next spring to talk to you about the WIC authorized foods. We have changes that are coming to the WIC food packages based on federal regulations. So that's another topic that we're really hoping we can share more with our pediatricians in the future. And I know my colleagues at GDSP and MCH are also interested in doing more specific topics based on AAP California member interests. So hopefully we can keep this going with future webinars to inform you about all the good work that we do. And with that, I think it is our time to perhaps help answer some questions.
Great. Thank you so much, Megan. I really appreciate it. And thank you to all the speakers. That was a very thorough, and I know an overview, and we asked you to put all this information in. I know it's a lot to digest. But as again, this is just an introduction to all what you do. And again, we have committed to planning out quarterly discussions on these topics, each individually. So there will be opportunities. We have questions and we only have a few more minutes. So I just want to make sure there was some question that had come in the Q&A that was regarding I just wanted to, I know that it had already been asked or answered here. It was regarding home births, if they get the newborn screen for those babies. And I just wanted to let you guys know that if you look in the Q&A, that you can see that Dr. Michael had already answered that question. And yes, as you heard, that you need to register to be able to quickly access all the newborn screen results that is available then online. So you can access that quickly or more easily, not like before where we had to call in, which took a little bit of time and effort at times. But anyhow, the other questions that have come in here from before, I wanted to see if we can address some of that. And maybe Megan, also for you to say, there was a question about bi-directional information, meaning if you're identifying a problem with a child that is being seen in the WIC office and you have a child with anemia, or some other concerns, height, weight, does that go back to the pediatrician or does it go to somebody, the state level only?
Oh, absolutely. As part of that healthcare referral component, oftentimes many of our WIC staff who are serving in the local offices throughout the state are absolutely referring back to a participant's healthcare provider. That is a core component for WIC. We are not here to diagnose and often making those referrals back to the participant's pediatrician or healthcare provider. Absolutely.
Okay, great. Yeah, because everybody's worried, like, are we going to miss something? Or do you know something we don't know and we would like to know so that we can keep reinforcing all the education to these families and so that we're obviously saying the same things. Let's see here. There was another quick question regarding SNAP that came in. I don't know if you saw that. It says, do we know what's happening with SNAP on November 1st? No, it's okay.
Yeah, that's okay. It's certainly the growing concern. I cannot speak to SNAP or to CalFresh. That is actually under the California Department of Social Services. CDPH is different. What I can share, because I know there are concerns about WIC, given that we are a federal program, that WIC is open. So please keep referring your patients to WIC. our WIC offices are still serving, and the California Department of Public Health is still providing benefits to our families.
Okay. And another question came up regarding counseling of our patients, that they may be residing here, but if they're unauthorized immigrants, what are we guiding them in terms of trying to access some of these resources like WIC?
Absolutely. One of the things that I stated previously, U.S. citizenship is not a barrier to participating in the program. Only having a California residency is something that we do collect. So if you are working with any undocumented families, please continue to refer them to WIC if they may qualify based on their income levels, or if they have any conditions. That's what WIC is here to help provide support in that area.
Great. And I think you had also answered already that there's definitely resources in multiple languages, not just Spanish, it sounds like, so that our patient will be, can easily access that information, understand it, and take it home and make it useful. So that's good. Let's see here. There was some questions here regarding genetic testings for patients with developmental issues, including autism. And let's see here. Is that a question we want to answer?
There's Dr. McHale coming on.
She might be muted.
Okay, thank you. Yeah, I heard the term genetics and my ears perked up. So I'm not sure if the question was regarding genetic screening, newborn genetic screening for autism. Autism being a multifactorial disorder, that's not a disorder we tend to screen for in the newborn period. Most of the disorders we screen for are monogenetic single gene disorders with, early diagnosis and treatment will make an impact on that baby's life very early on. As time goes on and we are able to predict diseases more, that might change in terms of the scope of what newborn screening might do. But currently, right now, that wouldn't be something that would be amenable to newborn screening with the evidence that we have available.
Okay. And then I saw that they put in the chat the talk that you're going to be giving next week, and I took the opportunity to sign up. I think that's great. Really appreciate that. And we're definitely looking forward to future talks to dig a little bit deeper into sort of the genetic screening that we do. We do a lot here in California. So I think it would be very helpful for pediatricians to know what and why we're doing and what's been added and why that is, so we can communicate with our families as well. We do get a lot of those questions from families, and I know you guys are excellent at that, but we still get those as pediatricians. Now let's see here. Was there any other questions that be coming in here? Let's see here. And you already talked about the formula changes, and I know we have this formula shortage as of last year, and I know AAP was quick to try to collaborate and see what could be done, and I know that WIC was hustling, and we appreciate that. Those are stressful times, and hopefully we won't see anything more like that this year. And I think you made it very clear as well, Megan, that there are formula changes that happens depending on the contracts, and that pediatricians need to try to stay informed, looking at those sides to make sure that they are in fact not prescribing the non-covered formula to make it more complicated for the patients.
Dr. Rosen, we do have a couple questions that came in through the chat as well, or the Q&A.
Great.
Sorry.
Oh, it did come through the chat. Okay.
The Q&A, sorry.
The Q&A. Okay, let's see. Oh, something came in. Okay, great, perfect. Let's see here. Will the slides be shared so we can access the links to the resources later? I think that's going to be Cameron.
Yes, I believe that we will be sharing the slides with through PDF with everyone who registered to attend. Great.
And a reminder again to fill out the surveys so you get the CME credit. And then here's a question from Gail. What is the relationship between Center for Family Health, Mental Health Support, and it keeps on popping back and forth here, on the screen, the CalAIM initiative for mental health. And where did the money allotted for mindfulness teaching get directed? If a pediatrician is interested in teaching mindfulness to youth, where should we direct an email amidst the state organizations?
I can take that, Dr. Rosen. So
Thank
the
you.
CalAIM initiatives are amazing, and they are through our partner agency, the Department of Healthcare Services, so DHCS. So feel free to send any questions their way. They do have the Children and Youth Behavioral Health Initiative, and there are several different arms of that. There's a website that kind of explains all the different avenues of that. They're also helping with the mental health apps for children. So the CalHope apps, which would be Saluna for the older teens and adolescents, and Bright Life Kids for the younger kids. So any questions on CalAIM and those mental health supports for children can go over to our DHCS colleagues.
Great, super. And we're at 6:58, so I want to be mindful of time. And so I want to say thank you to, of course, our speakers, the state, Carmi, Cameron, everybody involved of putting this together. And they are putting the some more resources there, it looks like, in the chat, which is great. And there will be popping up a survey as well. So with that, I think we're going to conclude this presentation, and thank you to all of you that spent tonight learning about this, and for all the people that will be listening to this later from the YouTube channel link that will be posted later. So thank you to everyone. And is there anything else that we need to state, or otherwise I think we will leave it at that, and have a fantastic evening, all of you.